Welcome to OAC's monthly broadcast. My name is Christy Kuna.
And I am Mackenzie Burrows, and I am so excited to be back for my second broadcast episode today.
Welcome back. James is on vacation, so we're giving him a little reprieve, so thanks for filling in. Mackenzie is our engagement specialist, and she's actually the perfect one to be on today's episode because it is so much about community engagement. We're going to dive into that topic, right?
It's a topic near and dear to my heart, so I'm looking forward to it.
And I have to plug that actually Mackenzie just celebrated 5 years with the OAC, so congratulations. Thanks for your long-term service.
It's been absolutely incredible, and the OAC has come so far, so it's been a joy to watch how far we've come in this 5 years.
Yeah, I agree, and we have such a great team here, so it's always good to acknowledge that. We're still here on YouTube. I think it's going well, right?
So it's our second episode.
On YouTube specifically, so it's a good reminder to make sure that you are subscribed to our YouTube channel. It is an important way that you can get those notifications when we go live. We're going to stream a lot of content on our YouTube channel, so make sure that you are subscribed. You can just push the subscribe button that should be located somewhere around where you're at currently. Just make sure that you are subscribed so you can get all those great updates.
And sign up for those push notifications if you can too.
Yeah.
So today we're going to talk about the importance of an engaged community. And like I said, this is a topic that is really near and dear to my heart. We're going to talk about what it takes to build a movement in this space and also really what that means, because that can kind of be elusive. And today our special guest is going to be Ian Patton, and Ian's actually going to be joining us from Obesity Canada. He is the Director of Advocacy and Public Engagement. So that's going to be an amazing conversation, and Ian's so great. So I'm absolutely looking forward to having him on air with us.
This is a really relative discussion because OAC, we have our own membership committee, and this is a topic that we are talking about right now. And so happy to kind of dive into that with you guys watching from home and near far. But speaking of that, let's find out who's joining us today on our broadcast. I'm going to start by saying hi to Carl. Carl's joining from Louisiana. Welcome.
Welcome. And it looks like we have Laura. Laura is joining us from Niles, Michigan. And awesome. She says that she's excited about the topic of community, so I can definitely get on board with that.
And we also have Sherry from Brooklyn, New York, Debbie from San Angelo, Texas. Love to see that.
And then I see Janet Daniels again, who is ready and excited for another broadcast. So it looks like we have a good crew online here today.
I love seeing this crew build every single time. So definitely make sure you're inviting others to join this broadcast. It's a great opportunity to have this discussion. And as part of that, we want you to be part of this discussion with us. So use that chat feature for that very reason. Create community in there. We're talking about community today. This is a great way to do that. Plus, if you're in the chat,
we are going to be doing more giveaways, so you want to make sure you stay tuned through this episode and keep commenting in the chat, because later on we'll pull out a couple of you and reward you with our giveaways. So make sure you stay online.
What are those giveaways?
We have a tumbler right here, and then we also have a full convention registration, which is a $50 value and gives you after hours access to all the amazing educational sessions that we're going to be having. So really awesome giveaway. You want to make sure you stay tuned and engage with us in the chat.
Absolutely. So stay in the chat. So before we dive into our main topic, we do have a lot of important updates to give you. I'll have a special guest on for that in a moment. But first, we have to talk about the convention that you've probably seen across your email, your social channels. Hopefully you've seen word of this. It's taking place next month. Tomorrow will be 1 month until the meeting.
Wow.
Yes, so we are going to be kicking off July 17th to the 25th. Our convention is a fantastic opportunity to learn evidence-based weight management strategies from the leading experts, and there are tons of all great other events as well as other activities that you can do during the meeting. So we do want to give a quick highlight to a couple of those things that we know or folks are wanting to know about. So let's take a deep dive into our program agenda. Here you'll see our program at a glance that is a recent update to our website, which is located in the About section. So check this out after the broadcast. But here you'll find all of the amazing sessions presented. You'll see the first one leading off is our very own Meryl Littleberry, who was on our broadcast last time or a couple times ago. Yes, and so she was great, going to talk about resiliency through restless times. We're going to talk about the science of weight, science of obesity, disparities, which is a really important topic. Dr. Arya Sharma is going to join us. Really great, as you can see, some really great topics in store. So take a look in your at your leisure, and that way you'll see all the great stuff that's been planned for this year's convention that you truly don't want to miss.
You know what I really can't believe, and I've been doing convention for 5 years now, and I can't believe that at this virtual convention, all of this stuff is going to be accessible at people's fingertips, and it is a completely, we have a free registration option. So to be able to have access to all of this amazing, high caliber education with truly experts that are coming in from across the industry with all of their amazing knowledge, this is a really incredible event. And so we're really looking forward to it here. I hope you are too. So you definitely want to make sure that you join us next month.
Yes, and special thanks to our sponsors who make that free option possibility. But definitely check it out. You're going to hear lots more about that as we move on in the next couple weeks. So lots of excitement in store. So next part, we're going to get to dive straight into our advocacy update, which is a super important part of our broadcast to bring the latest and greatest when it comes to the efforts with advocacy that we fight.
Yeah, and so one thing that we wanted to share with you guys, and we always try to keep you up to date on what's going on in the advocacy realm, because truly there is something that the OAC is doing every day. And one of the things that we're currently working on is an outdated rule in Florida that actually limits access to obesity medications and obesity care by telemedicine. And so in early June, OAC's president and CEO, Joe Nadglowski, actually went to the Florida Board of Medicine and asked them to reopen and rewrite that rule to reflect modern care, modern obesity care. And that's just really amazing because that's such an important need that we have in this space, is greater access to coverage. And actually, Christy, because of that work and because of the presentation that Joe did and the talk he gave to the Florida Board of Medicine, they've actually agreed to reconsider that rule and look toward expanding and improving obesity.
No, that's exciting because it's a great example of how just speaking up and representing those who need to be represented, how that really does work. So we'll keep a strong pulse on this, and it's especially important as we dive into the next topic around a new therapy that was recently approved that we're going to dive into. So maybe let's start talking about that now, because I know that's on a lot of folks' radars right now. So there was recent news of an obesity treatment that was approved, an obesity medication, and it's known as Wegovy. And you might have seen this dominate the headlines in the past couple weeks. And I know that so many people even pinged me and said, family members saying, I just heard about this. I'm like, yes, of course, this is something we've kept quite a pulse on.
You might have seen it on the OAC blog and on social media where we posted it. So it's definitely been all over the internet.
So it's made the news. Lots of, you see those headlines there, some of them are calling it a game changer. We're going to talk about that. So we thought, though, the most appropriate way to talk about this is to have the experts involved in this. And so we're having our OAC's very own president and CEO, Joe Nadglowski, join us, along with our special guest, Dr. Robert Kushner, who's an obesity medicine specialist. But Dr. Kushner also has served on our board and serves as our program chair. He's a great supporter of the OAC, but has followed this update quite closely. So we are so happy to have Dr. Kushner and Joe join us on OAC's broadcast. So welcome, Joe and Dr. Kushner.
Welcome.
Thanks for joining us.
Thanks, Christy. Thanks, Dr. Kushner, of course, for being here with us today. So we're here to talk about Wegovy, right, and this new medication. And it really does seem like healthcare professionals and the media seem more excited about this therapy than any recent therapies around obesity. So what really makes this the game changer people are calling it?
Well, thanks for having me on and being with you on the OAC webinar. We think of it as a new generation or game changer, primarily because it's about 1.5 to 2 times more effective on average than currently available medications. So in the 68-week trial, so a little over a year, and there's about 4,500 individuals participated in the overall trials. Average weight loss was 15%. Now, so if you weigh 230 pounds, for example, it comes out to over 30 pounds. Joe, what really I think was the game changer that got my attention as an obesity medicine specialist is that 1/3 of the enrolled subjects lost 20% or more of their body weight. That's over 60 pounds. So clearly, it's not all about just weight loss. It's not about getting thin. It's about overall health. And that was studied as well. Reduction in blood lipids, blood sugar, inflammatory markers, improvement in quality of life. So all of those things were positive. And that's really what the game changer story was all about.
Thanks, Dr. Kushner. The other thing is this medicine's a little different than some of the other existing medications as well. So can you tell us about some of those differences?
Yeah, this is a new direction in weight management medications, and they're really more hormonal. So this particular drug mimics a naturally occurring hormone that we all have that is secreted when you eat, and it helps us feel full and less hungry, and that's in part why we stop eating. So by taking that hormone and boosting it, and then delivering it back to the individual with a once-a-week injection, it controls appetite. And it's different than some of the other medications on the market. So this really is a new direction of all the categories that are now being investigated to help with weight management. Most of them are in this hormonal category.
Right. I do want to emphasize to our viewers today what Dr. Kushner said there about it being a once-a-week treatment. That is actually a major change, right, than we've seen from the other treatments that exist already for obesity, which you often take daily and sometimes multiple times daily, right? So that is one of the big differences.
Mm-hmm. That's correct.
So you talked a little bit about efficacy already. What about safety and side effects? What should people expect if they're considering this medication?
Well, as I said, this drug at this higher dose was studied out to 68 weeks, and there's an ongoing trial. I also want to mention, Joe, that the same medication, it's called semaglutide, has already been on the market as an anti-diabetes medication at a lower dose for several years now. So we have safety from that. We have 5-year study going on that has been done with that lower dose, and a current study at this higher dose, which will be 5 years for real safety. Regarding the side effects, like all medications, there's always this balance. The side effects are primarily gastrointestinal, nausea, vomiting, those types of things, primarily occurring during what's called dose escalation. The first 16 weeks, you have to start at a low dose and work your way up. And they were described by the subjects in the trial as mild to moderate and transient, meaning short term. Interestingly, of all the individuals in at least one of the trials, which was 2,000 individuals, 7% of individuals dropped out. That was it. So over 90% of individuals stayed in the trial despite some of these side effects that I just mentioned to you.
Thanks, Dr. Kushner. So I think, if our viewers are watching today and thinking to themselves, obesity medication might be something that I want to consider. I know most people, when they come to see you, there's probably an expectation around medication and behavioral management therapy. But what if they're talking about their everyday doc? How do you recommend they approach this topic with their provider?
Well, we as a profession need to do a better job, and OAC and people like myself are really trying to get our primary care providers to be more proactive and have the conversation with you. But short of that, I would be proactive and endorse for yourself, advocate for yourself to bring it up to your healthcare provider and really verbalize to them, I'm struggling with my weight, I'm following a healthy diet and physical activity, I know how important that is, but I need more help. And part of that help may be becoming more aggressive on top of a healthy lifestyle and thinking about pharmacotherapy. Can you help me with that? And if you cannot, perhaps you can refer me to someone who is comfortable prescribing medications and having that conversation, and that would be an obesity medicine specialist.
Yeah, thanks for that. And for those of you who are watching, if you're looking for someone who is an obesity medicine specialist in your area, we have our obesitycareproviders.com database where you can actually look those up in your area, especially if you get a physician who's really resistant and doesn't even want to give you a referral. You can find out some of those folks on your own. So I think, Dr. Kushner, one of the other things that I know you and I are both passionate about, and for me, for this truly to be a game changer, that language, is we have to improve access to these medications. I think one of the realities you and I both face is that some people will come into your office and you think they'll be a great candidate and they won't have coverage. How big of a challenge is that for you in your practice?
It is, and of course, OAC is a leader in this field of trying to get legislation and advocating for all individuals who are suffering from obesity, or those of us who treat patients with obesity. It's a major barrier, and you're absolutely right. I'll see patients in my clinic all the time who are wonderful candidates for becoming more aggressive and using a medication, only to find out they don't have coverage, and how frustrating that is. So we need to continue to advocate for it. And of course, you all talk about having individuals advocate for themselves, kind of a bottom-up strategy. So we need to do more and more in that area.
Thanks, Dr. Kushner. And I do want to remind our viewers that, this is why we push so hard for you to support legislation like the Treat and Reduce Obesity Act and even state-based legislation to cover these medications. The reality is there's lots of people who would benefit from them, but frankly, they're expensive, right? And it's not something most people can afford out of pocket. So therefore, we need this insurance coverage to make sure people can have better access. So Dr. Kushner, we're short on time today. I look forward to much more information from you about Wegovy in the future. Pretty much can guarantee our members you'll write an article for the magazine about it. You'll likely help us update our obesity treatment brochure as well with more information. But thanks again for sharing this a little bit of information, and we look forward to hearing more from you in the future.
That is a pleasure. Thank you so much for having me on.
Christy, we'll turn it back to you.
Yes, no, thank you. That was a great discussion. We had some good chatter from our audience as well, but thank you too for joining us, and we look forward to more information to come.
Yeah, Christine, I think that call to action that they gave there at the end is absolutely so important. Legislation like the Treat and Reduce Obesity Act can truly change the landscape of obesity care. And so we really encourage you to support the Treat and Reduce Obesity Act. Its acronym is TROA, spelled TROA. And if you want to get involved in helping us support TROA, you can actually go to the OAC Action Center at obesityaction.org/TROA, where you can use our automated message generator and actually get assigned to your state legislators, where you can write them a message, which we've also written for you. And you can send that message and advocate for TROA to be passed and for your legislators to co-sponsor it. So we definitely encourage you to do that.
Yeah, and a couple good reminders you could see there on your screen were our obesity care providers to find a physician, as well as more information on our blog that we have, that you can get all the updated information, which we do update that all the time since more information is coming out as we know it. So. But yeah, so I think lots of excitement on the horizon for treatment. Yes. But I think we're ready to jump into our main discussion today and bring on our special guest. It's why community engagement matters more than you think, and I love that title because I think this idea of community is kind of very broad, right?
Absolutely. In our world, our community is our membership, but our membership is our community, and we're going to really dive into what that word means in this space, and also talk about the importance of connection and building a movement, but also what building a movement really means. You'll actually see that there's a bunch of definitions, and so we're going to dive more into that today, but we encourage you to be a part of this discussion with us in the chat. We definitely want to bring some of your questions and comments into this conversation, so please join us.
Yes, and we're ready to welcome our special guest, Ian Patton, who is the Director of Advocacy and Public Engagement with Obesity Canada. Ian, it is so wonderful to have you on our broadcast.
Welcome, Ian.
Yeah, we no stranger to the OAC, right? Because we work together all the time these days through all our international activities, the Global Obesity Patient Alliance. But I think it's worth noting that OAC and OC have been working together, and we really do such great knowledge sharing. So I'm really excited about this topic to talk about it with you, because this is something that we exchange notes about and have talked about just kind of on the side, but it's a good opportunity to have our folks involved in the discussion as well. So thanks for being part of it.
Yeah, and you mentioned convention, Ian, and that's an example that I always like to lean on, because I think one of the strongest examples of how people feel a sense of community in the OAC's world is by coming to our convention. We've hosted in-person meetings in the past, and we've done virtual last year, and we're doing it again this year. But the essence of community is still a part of our convention and a part of everything that we do in general. But I think it's a good reminder that community isn't necessarily, something tangible, meeting up in your local community to talk about or do something, but, it's really about togetherness. So Ian, I'm kind of curious, in your space, how would you really define that word, community?
That's a great question. For us, I think community right now, for what we've built and what we're doing, a lot of it is having people, like-minded people, or people who get it. And I think that's something that we don't have a lot of in our community of individuals who are living with obesity. A lot of us kind of deal with this on our own. We're silent about it. We keep it to ourselves. We don't have groups or peers that we're connecting with who understand what we're going through, and we feel like we're alone. And I think having that sense of community and togetherness and people who understand and those sorts of things can be really, really helpful. I know for me personally, that was one of the biggest things for me, is just recognizing that I wasn't alone. I wasn't the only one who was dealing with what I was dealing with, and thinking the things that I was thinking, and not feeling alone was the biggest part of it.
No, absolutely. And I think we hear the same sentiment from, folks who are part of our community, and even folks viewing right now. I mean, the chat, is alive with this idea they come to this place just to kind of connect with one another, and so, when we think about this connection point that we have, I think having the mechanism to do that is really important. So maybe tell us a little bit about your OC Connect community that we are so excited about, and we've kind of watched from afar, and are kind of,
our eyes are on you.
Yes, our eyes are on you, because we're going to be launching something in the future similar. But tell us a little bit about that and that platform that's allowed that connection to really happen.
Sure. I think what I'll do is I'll take a quick step back and just give you a bit of an idea for people who don't know about Obesity Canada and who we are. We initially started as a research organization. It was an organization directed at health professionals, bringing together health professionals, academics, and researchers in the area of obesity. And it was over the course of several years that we recognized that we were kind of missing one big piece of that puzzle, and that was that lived experience, the people that are living with obesity, and supporting those individuals. So that's where we kind of came in with this idea of kind of creating our community, which was the inspiration we got from you guys at OAC. And there was a couple problems we recognized with that attempt at trying to build that community. Was that people under normal avenues, so like in social media, whether it's Facebook groups and stuff like that, people weren't as willing to engage in those places openly. They didn't want to see that they were people in their Facebook groups or whatever didn't want to have it known that they were liking an organization that was about obesity or involved or sharing that sort of stuff. So there's a little bit of shame there or stigma associated with that. So we needed to create something that was a little bit more private or away from that normal avenue of social media. So we created OC Connect, which is on a separate platform. It's a private community. And for us, it gave us the opportunity to bring a lot of people together, provide an avenue where we could provide the education about obesity as a chronic disease that we want to, so we can inform individuals, we can empower them and allow them to speak up for themselves or get involved in some of the stuff that we're working on in terms of advocacy. But one of the biggest things is that sense of community where they're engaging with each other, they're providing peer support, and it's in that safe, kind of contained environment, and it's monitored, and it just really allows us to have that nice, safe community where people feel comfortable engaging.
Yeah, I mean, the chat actually is reflecting exactly what you just said, where we have Debbie sharing that she feels having community is key, but then Mary also shares that her community is her lifeline and that has made such a difference. And I think that's just kind of those things you all have keyed on that really are such an important part of the work that you all do. We know.
And I think Ian, you hit on something that's really particularly something that I'm particularly passionate about is the stigma in the space. And even as an employee of the OAC, I live and breathe this stuff every day. But even if I choose to post something about the OAC or about the topic of obesity online, I always wonder, what is my comment section going to look like? And it makes me very conscious of how other people on the outside of this world that I'm in at OAC are viewing these things. And so if that's someone like me who is very conscious of that, what about the everyday person who struggles with obesity? There are only so many Facebook groups and public discussion forums that you can be in online. So having a space like this where you can consume unbiased education that is trustworthy, but also being able to connect with people and know that these people don't judge you, they understand your lived experience. I mean, that's truly life-saving. So I think having that community is just super important.
Yeah, absolutely. And I was the same way as you, when I when I initially started, I wasn't always keen on sharing my Obesity Canada stuff on my personal platforms.
Yeah.
even though I was working with the organization and I was very proud of the work I was doing, but I still had that stigma associated. You know, what are my family going to say or think about this? And are they going to frown upon it, or my friends and people that I knew from years ago? And do I want them to know that this is, you know, what I'm invested in now? And I eventually got over that. It took some time. But I understand that feeling for sure. And so for individuals who aren't as involved as you or I, it's definitely a concern, definitely something that might not be as comfortable being involved in so openly. Yeah.
No, absolutely. But I think these kind of platforms that you use and even fostering community just helps with that, the stigma of, you know, we've always said that from the very beginning here is that, you know, who wants to be a card-carrying member of an obesity organization? And we say that, you know, very broadly, but I mean, there was a lot of reluctance there with that. And so I think this idea of community has really changed that, to think about first, let's get folks connected into that world. And it's less about being an official member versus being connected and belonging to something, which does foster some of those, you know, really exciting moments of progress that, you know, you guys have seen. So we want to chat about that. We know that this, you know, it takes a lot to build this movement, if you will. You know, feeling empowered to do something. But I know you guys have had some really great successes recently that have really been, or not success, even progress points that have been really fostered out of this community. So maybe can you speak a little bit to some of those and give our viewers at home a look at you know, what has happened as a result of creating a community?
Yeah. I think the biggest thing that has come about recently for Obesity Canada would have to be our clinical practice guidelines that we published last year. And so those clinical practice guidelines would actually be the part of the inspiration or the purpose for us creating OC Connect, the community. And so I'll speak about those quickly, and then I'll talk about like what's come after that. So with the clinical practice guidelines, you know, we created these new guidelines that are, you know, now evidence-based recommendations for the treatment and management of obesity. So they give you know, health professionals and people that are living with obesity, you know, clear guidelines on what the most current up-to-date evidence is and what's available up here in Canada for the treatment and management of obesity. They were pretty groundbreaking in terms of like the attention that we got from these guidelines and the how we went about it. So there was a lot of patient involvement. There was an entire chapter on weight bias and stigma, which is something that we haven't really seen before. So there's a focus on that. And they've been really well received. Now, what we want to do, typically what happens with clinical practice guidelines is that they're designed for health professionals, and it's not something that the general public tend to engage in or use. But even with the health professionals, they have to go out and actively seek. And you know, we've got, you know, 80,000 doctors up here in Canada. And, you know, if we just publish these, they might look at them, they might see the publication, but they might not actually utilize those guidelines. So we wanted to have both a top-down and a bottom-up approach to kind of getting those guidelines out there. And so that bottom-up approach was to engage and activate patients themselves, individuals living with obesity, to use those guidelines, make themselves aware of the information that's in there, and take it to their doctor, ask their doctor about these things, start getting those conversations going. And so that's why we wanted to create this community, because it gives us that platform to, you know, educate about that information, along with creating that sense of community and peer support and stuff like that. So it's been really successful in terms of doing that. We've got like lots of people who have sent me messages or posted in the community talking about how, you know, being involved in OC Connect has actually given them the, you know, the information that they need and the empowerment to speak up and ask their doctor about, you know, the possible treatments, whether it's medication or asking to be referred to bariatric surgery or any of the other treatment options that are available there. So it's really been empowering in that sense, and creating a little bit of that bottom-up movement of getting people activated and asking the questions that we want them to ask.
Yeah, Ian, I think that's an incredible example of the power behind community. And one thing I also think is important to note is that, you know, the biggest marker of community isn't necessarily getting something, publicly passed or listened to, but there are so many things on a personal level that connecting with your community is good for. And in the past 5 years that I've worked here at the OAC, I have encountered so many members who have, just told me, whether it is at our in-person convention or via email or even over the phone, it was like, the OAC community really saved me because of the friendliness, the welcoming, the non-judgmental space and the people that are in here. I faced regain, but I'm not really embarrassed by it anymore because, I know that it's not my fault and that there are so many things going on beyond my biology that I can't control. And these people are here to help me and encourage me. And there's even been people here that have said that, the OAC's community has helped them recognize that obesity is a disease, and it's kind of lifted the burden off of them and some of that internal stigma that they felt. And these are all just ways that, being a community is really impactful. So it's impactful for people on a personal level and in their individual lives, and for empowering them and inspiring them and supporting them, but also really important for making some of these bigger changes that we know we need to make in the obesity space.
Yeah, absolutely. And from my view, what I'd like to do is I'd like to get, the 8 million Canadians or 8 million plus Canadians that are living with obesity to all, get angry, speak up, demand change, and be advocates, and can, be part of a huge movement. That's not realistic. It's not going to happen.
Yeah.
Not everyone's going to be, as eager to stand up in front of a bunch of people like I am. But equally as important is that self-advocacy, being empowered yourself, being willing to, ask for help when you need it, or, seek out help, or even just the empowerment to feel better about yourself. Like you mentioned, like those sorts of things are huge. And I love getting those emails or those messages. Those are huge. Even when people come into our OC Connect community, they have to we ask them a couple questions. They're very, very basic. But I'm the only one who goes through and checks up on them. And so I read through all these questions and the responses. And so a lot of them, people come in and they have a clear, like, weight centric, I want to lose weight, I'm here to find ideas and all this stuff like this. And then very quickly after that, I get a lot of messages from these people where they've done, like what you said, where they recognize that obesity is a chronic disease, or it's a lot more complicated, and their goals or their mindset has shifted away from that weight-centric approach to, they have a whole different kind of approach to how they're viewing themselves and obesity, which really makes me proud. It's awesome to see the community have that impact.
Yeah, it's incredible.
Yeah. And that kind of what you described is just that movement, right, that we're talking about. And it takes so many layers. And it is like what you said, it's not about, you feel comfortable being vocal, but it takes time to feel that that sense of compelling, to be able to do that because of stigma and bias that we face as a community. So I think community is a great place to start, but advocating for yourself and your own health is important. We know that advocating for others, but also advocating for the cause and just being empowered and creating that movement for the cause. That's where we want to get to, right? So it's so much. What you just said is just so much. Just this combined. It's not just as simple as getting engaged. We have a community. It has so many layers, right?
Yeah, and I'll just throw on top of that we threw out the word movement earlier, and a movement isn't about just getting involved with an organization. Right. It's truly just being empowered to do anything. So we can really broaden up that definition of community and movement a little bit and kind of see all the different things that it encompasses.
Yeah.
Yeah, and when I use terms like movement or even advocacy or become an advocate, and I've told people this, you can become an advocate a number of ways. You could be like me and want to go and talk to people on Parliament Hill and change for the policies that are in place nationally or whatever, and that's great. You could be an advocate locally. You can be an advocate within your own family or friends or peer groups, or you could just be an advocate for yourself. And there's, like you said, layers to that, and it all matters, right? None of it is more or less important. I want lots of people doing all of those things and being engaged in all those different layers.
Well, yeah, and just from looking too, there's lots of folks from your community in watching, because I know you guys did a lot of promotion to, to give folks this idea of what community means. I love this discussion. I think we could spend even more time talking about it, but
I could go on for hours.
We are short on time, but we know we talk offline all the time, so that's the saving grace.
Yeah.
But we'll have more of these discussions. But Ian, thank you so much for being a part of our broadcast. We hope you'll come back another time and we can continue this discussion.
Absolutely.
Absolutely. You can have me anytime you want, maybe closer to our conference that we're going to be having in the fall. So we're going to have OC Connected 2021, which is our virtual conference. So
Very cool.
I'm sure a lot of us will be at your convention, and you're all welcome to come to ours.
Yes,
Absolutely.
Great partnership. Thank you so much for everything you guys do to support OAC, and thanks for being a part. And I know we'll talk very soon. Thanks, Ian.
Thank you.
No, it truly is such a great topic, very relative. And so we hope at the end of all of this, you guys really get this sense of, what community means. You can really make it what you want it to be because everyone's individual circumstances are different and their motivators are different. And so just being a part of this broadcast as you watch, whether it's live or after the fact, you're being part of it. So thank you for that, for everyone watching at home.
Yes, and as we mentioned earlier, we are always, partnering with Obesity Canada and learning what they're up to and learning from them. And so you can expect some exciting news coming on the horizon for our community. But the best way to make sure that you get information about that is to stay connected with us.
Yes, it's always a good reminder. You have all of our handles to follow. If you haven't followed, it's a good way to kind of keep up to date and the pulse on everything. So with that, it is so, this goes by so quick every time, but we've come to the end of the broadcast, which means it's giveaway time, right? So let's find out who our lucky winners are. It looks like our first winner of the full convention registration is Debbie Yeoman. Congratulations, Debbie.
Congrats, Debbie. And it looks like the winner of the OAC Tumbler is Candace Wilrich. So congratulations, Candace.
Awesome. So great reminder for you guys to subscribe to our YouTube channel. You get more notifications. We hope you enjoyed this broadcast. Great, having you back. So you'll be back again, I know, at some time.
Please invite me back.
Oh, we will, anytime. So as we close, it's always such a good reminder that OAC is so excited to bring this broadcast to you every single month. We are a charity, and so we do rely on the generosity of folks like you to help support these efforts. So we always want to encourage and to make OAC a priority in your charitable giving efforts. And we actually just put together a new video that we're kind of debuting right now. You get a sneak peek at this. That really showcases a lot of folks' reasons why they support the organization, why they give.
It's very inspiring.
Yeah, so check it out as we close the broadcast, but we want to just thank you guys for joining. We will see you next month. We're doing the broadcast on
July 14th, and this is going to be our special convention episode since it is only taking place 1 week before the meeting. So that is definitely an episode that you do not want to miss. We have a lot in store for that.
Great. Well, until then, we will see you online, and we'll see you next time. Thanks for joining us.
Bye, everybody.
Finding the OAC has been like finding home. I was at a point in my life where looking for something to channel my passion.
They work really hard building a community of advocates, health professionals, and everyday people.
Their mission aligns with my values, and patient advocacy and combating weight stigma are really important to me.
OAC believes everything that I believe in: education, support, weight bias, stigma.
Like a home, you have to support it to keep it going so it doesn't fall down around you. And so I've always been a donor.
The OAC does everything for the patients and fights for us, so that's why I donate.
That's why I give monetary donations to the OAC, because I know that every dollar is spent putting together fantastic educational opportunities.
I know that my donations go where they're supposed to go. They're transparent, and they do it. They're action-oriented, and they have results.
I am a financial donor. I've always been a financial donor, and I encourage you all to be financial donors.